Welcome, everybody. So nice to kick off our summer series where we will have three-part series to this, June, July, and August for our summer series on holistic medicine. And I am absolutely thrilled to start us off this evening with talking about herbs, supplements, and vitamins and dietary impacts to the microbiome. For July, we will be discussing, and that's going to be on July 14th. We will talk about acupuncture, mindfulness, and pain management. And that will be together with Dr. Angela Lorbeck. And then for August, we will be talking about mind body stress reduction, and we will bring back Mindy Eisenberg from Yoga Moves MS. So a wonderful lineup that we have for our summer series. This is our second year of running a summer series like that. Last year we had our three-part series on the mind diet. So that is logged in our video library for all of our conversations on brain health. So if anybody has a hard time finding that, feel free to reach out to me and I'm happy to share where you can locate that information. These conversations on brain health, town hall meetings are supposed to be interactive, so we welcome you to put any questions in the Q&A box, and we will make sure we answer as many of those questions as we can within this 1 hour allotment. So on that note, I would like to introduce our two wonderful speakers that we have here with us tonight. We have Dr. Jackie Bainbridge. She is a professor and vice chair of research in the Department of Clinical Pharmacy, Skaggs School of Pharmacy and Pharmaceutical Sciences, and professor in the Department of Neurology at the University of Colorado Anschutz Medical Campus. That is a mouthful. Dr. Bainbridge authors several books, chapters and articles on multiple sclerosis, epilepsy, movement disorders, and cannabis education. She is very committed to conducting research on the disease states and topics listed as previously mentioned. So super honored to have Dr. Bainbridge with us tonight. Um, our second speaker is Dr. Tom Holland. Several of you might have seen him before as part of our brain health programs, and we like to wrap him in as often as we can. Dr. Holland is a physician scientist at Rush University Medical Center, affiliated with the Rush Institute for Healthy Aging. Additionally, he serves as an assistant professor at both the Rush College of Health Sciences and Rush Medical College. Dr. Holland's primary research focus lies in investigating the impact of lifestyle modifications on the progression of chronic diseases and as individuals age. So again, thank you so much, both of you, for being here tonight. It is really an honor to have you fill us with some wonderful information. And I know this is a topic of great interest to many, as I particularly see in our audience. We have a lot of people. So happy to have you with us. On that note, I'm going to turn this on over to Dr. Augusto Miravalle to get us kicked off.
Thank you, Kathy, and thank you again, Dr. Bainbridge and Holland, for joining us today. It's truly an honor. And just to add to the many accolades for Dr. Bainbridge, she was elected Giant in Multiple Sclerosis by the Consortium of MS Centers in 2024. Was that last year, Jackie?
Last year, yes.
Last year. So that's a high honor in the MS space. And so I thought to maybe start with one basic question, Jackie, for you, which many may not be familiar with the role of pharmacists and what role they play in healthcare. And I know that you've been an advocate for expanding that role and truly in meaningful ways. And one of your roles as professor for the School of Pharmacy is truly to integrate the role of pharmacists in healthcare. So can you give us a summary of, how would you describe the role of pharmacist and what would you like to see in the near future?
Well, let's start with what I'd like to see in the near future, and thank you all for that great introduction. It is a mouthful, I know. I apologize for that. But I would like to see more pharmacists integrated into specific, obviously, all clinics, but specific to what we are doing into the neurology clinics. Um, I think the pharmacist plays a vital role in not only helping with obtaining medications, but really helping with the correct selection of medications. So, just in terms of thinking about drug-drug interactions, what traditional medications patients are taking, what herbal supplements or cannabis agents that people may be taking, because a lot of these medications or a lot of these products, we don't know about the safety. So it's really difficult to make recommendations on dosing for these agents, and also to figure out the drug interaction piece, which that's really where your pharmacist is very vital. Also, and especially when we're talking about multiple sclerosis, we're talking about many symptomatic or other problems that people with MS may have. And so some of our practitioners may need assistance with those symptomatic medications, since we really deal with all of the medications across the spectrum. So I want more pharmacists in the clinic, bottom line.
I agree. I couldn't agree more. And I had the pleasure to working with you when I was a faculty at the University of Colorado, and it's tremendous amount of benefits that that brings to the table when we have a pharmacist in the team. Because as you mentioned, in MS, the therapies are very complicated, but in addition,
Mhm.
our patients often end up taking many medications, and so then this drug-drug interaction plays a role, and we are that's Holland here today because medications and diet go hand to hand. And medications,
Mhm.
vitamin supplements is this spectrum in which it's hard to draw the line. And sometimes we forget that vitamins and supplements are actually drugs itself.
Mhm.
So maybe we can kick us off with a question for Jackie, Dr. Bainbridge. So, what are the most commonly recommended vitamins or supplements for people living with MS? And do we have any evidence that actually we can share with our patients in terms of efficacy of these supplements and vitamins?
Yeah, so that's a really good question. So, I would say vitamin D. I particularly like vitamin D3 because it's already activated by the liver. But vitamin D2 is also, highly recommended. We know in multiple sclerosis that may decrease the somebody getting a diagnosis with multiple sclerosis. It may also help with relapses and also MRI brain activity overall. So vitamin D is really important. Along that line, I would say that getting too much vitamin D is problematic. So this is something that's easily checked by laboratory, so serum concentrations. And that should be done on a regular basis, maybe yearly, every other year, just to see where those levels are. So vitamin D is definitely up there. Magnesium, also another important player. So just in terms of helping with sleep, and there are different salts of magnesium. So I've been tending to recommend the glycinate formation or formulation of magnesium. And sometimes it comes in a really big pill, but you can also find it in a capsule formulation that's easy to swallow, and that sometimes will help manage blood pressure, which we know, and Dr. Holland, as you know, as people age, there's a tendency for hypertension, so it may be helpful there. It may also help with sleep, mood regulation, and just helping people to overall feel better. So, and I would say staying away from mag citrate unless you're very constipated or going for a colonoscopy, you want to stay away from the citrate formulation of magnesium. And then also calcium for bone health. Obviously, especially really important as people age. And there's actually some evidence, low-level evidence, and a lot of these products, and Augusto, as you mentioned, we don't have a lot of evidence. There's not a lot of great clinical trials out there for much of what we recommend in this realm. Sometimes we have to steal that information from other disease states or disorders. But with magnesium, there's a study or two out there that looks at adding magnesium, calcium, and vitamin D together, and that may help decrease some patients' exacerbations of multiple sclerosis, but that's low-level evidence. I would also say the B vitamins are very popular. Again, the vitamins can be helpful. Some people, a B complex. It's probably recommended that people take the methylated form of B vitamins, as opposed to just any form that you find over the counter. And you can get too much vitamin B. So, and I know that's one thing that we have to caution, because we know taking too much of the B6 and B12 can actually cause neuropathy. And sometimes that doesn't go away. So you don't want to overdo any of these supplements. And sometimes the B vitamins tend to give people a little boost of energy. So if you're going to consume a B vitamin, it's best to probably take it in the morning. And then we also have other supplements that people are taking on a regular basis for brain health. We hear that all the time. So, we think of the ginkgos of the world. And again, the evidence is really not profound. I would say I don't recommend it, and I don't recommend it for another reason, because it actually can cause bleeding, especially in people who are prone to that. And then there are vitamins that people are really taking for depression, mild depression, and I would recommend against that. So that's the ashwagandha and the St. John's wort. Many drug interactions there. And again, in clinical trials, it really didn't look like it was more effective than our traditional antidepressants. So that's in a nutshell.
Wow, that was a lot. Thank you, Jackie. And let's try to unpack some of that, because you share a lot of really good information. And Kathy, I don't know if you see some questions that perhaps can help us unpack some of that information.
Well, and I think one in particular is really relevant and probably important to highlight at this, since you just discussed this, is, are certain supplements supposed to be taken at certain times of the day? Like, is it better you had mentioned with vitamin B, it's probably better earlier in the day because it can give you some energy. But what about some of those other supplements? Is it best to have it with food? So maybe if you could speak a little bit about that.
Yeah, so most of what I mentioned really should be, it doesn't matter, but if with food or not with food. So it depends on if it bothers your stomach. So sometimes, especially if you're taking a bunch of these things and you're taking traditional or conventional medications as well, that may actually just really cause your GI tract to be a little upset or angry with you, and it may revolt. So we don't want that. Definitely magnesium, especially at night, is probably what I recommend. And then also, I didn't mention, but fish oil. Fish oil is also a big supplement that people are taking. So with or without food, really depending on you. But I would definitely say common things are common. So MS affects more women than men. We know it's an autoimmune disorder, and autoimmune conditions sometimes tend to live together. So thyroid conditions. So if you're on levothyroxine or Synthroid, you want to make sure that you're taking that in the morning. And you want to keep that away from food. So that's a traditional product, right? So you want to make sure that you're spacing food an hour after you take it. So we recommend, setting your alarm an hour earlier, taking your Synthroid, and then going back to sleep for an hour, and then consuming food or other medications. Or if you can't do that, and you have no choice, then you wait 2 hours after taking your Synthroid. So timing is important, and I would definitely put another plug in for the pharmacist, so you can always have that discussion with your provider or your pharmacist as to what specific medication you're taking or consuming, and the best time to take it. So and I'm glad you brought that up, actually, because I was talking to a friend of mine, not too long ago, and she said, I've never had a problem sleeping, and all of a sudden I am. And I said, well, are you doing anything different? And she said, well, I was just put on levothyroxine, or the brand name is Synthroid. And she said, I just take it before I go to bed, an hour before I go to bed. And I'm like, well, that could be a problem, because that is also stimulating. So timing is important.
Fantastic. And there are a lot of questions that have come in, and some of these are really great. How about, is vitamin D plus K better than just taking vitamin D on its own?
Well, a lot of times you will get that mixture, so vitamin A, D, and K together. So it does help with absorption. So that can be better, but again, what you want to do is just make sure you're not at risk for bleeding. Also, a handful of those vitamins are also fat soluble. So the K, especially A, is fat soluble, so it's going to stick around longer. So again, that you want to make sure that you're taking the recommended dose and not going overboard, because those medications, can build up in your system. And also vitamin K, you have to be careful if you're taking blood thinners, or have a prone to clotting or bleeding. So that's important.
Excellent. So,
Fantastic.
Jackie, you mentioned dose in terms of vitamin D, and what is your recommended dose, and what level are you trying to target when you're recommending vitamin D supplementation?
Yeah. So, and I think a lot of providers have different feelings on this. So I would definitely check with your provider, but we're usually recommending a good vitamin D level. So the upper limit of normal at the University of Colorado, what our lab reports is upper limit of normal is around 50. And we're usually, reaching that target, maybe going beyond that. So even in the 60s and 70s, and even 80s, depending on the person, and depending on the lab values again, and if it's a deficiency or not a deficiency. So following the levels is really, really important. And so anywhere between 700 international units to 2,000 international units, sometimes 5, sometimes 10. So people who are really deficient and are really hard to get to that serum concentration that you're looking for, those people can be on 10,000 units, so international units per dose. So it really varies. And the harm with taking too much and not following that level is, we know it can actually help form kidney stones. So
Right.
that's problematic.
Excellent. Well, we're going to give you a little break now, Jackie, and I'm going to change now to the topics, what kind of like in the same area, to the Dr. Holland. And one of the common medications that our patients may take is antibiotics, whether it's for urinary tract infections or any type of infection. And sometimes those antibiotics can change the microbiome. So there is a lot of hype around probiotics and prebiotics and when to take them, when not to take them. Do I need to take probiotics all the time or only when I'm taking antibiotics? So can you maybe just give some clarification on the area of, what is the microbiome? What are probiotics and prebiotics, and when is recommended to take those?
Yeah, so first kind of getting into the microbiome itself. So when we think about the gut microbiome, it's bacteria. And we have normal flora on everywhere of our body. We have staph on our skin, and staph makes sure that we don't have overgrowth of other bacteria. So we also have this bacteria in our GI tract. And what that bacteria does is, first and foremost, it helps protect the GI tract from invasive bacteria, but it also allows for the digestion of the kind of the final digestion of our foodstuffs. Because as we intake food, we need to have chemical and mechanical breakdown, and then we need to have it absorbed. And so the gut microbiome allows for us to have that kind of final digestive component for the absorption. So when we think about prebiotics, prebiotics are setting up the environment that helps grow good bacteria. And so that's going to help foster the growth of these good bacteria. Whereas the probiotics are going to be the bacteria themselves. And what we see with foodstuffs that are going to have bacteria, it's going to be a lot of our fermented foods. So say kimchi, or we can have yogurt and kefir. And this is going to have a lot of really good bacteria. If you get a kombucha, for instance, you'll see that it'll have a certain number of colony forming units on it. And so that is actually putting the bacteria into our system. And the good thing about having the bacteria is that we want to have good bacteria, but we also want to have a diverse, kind of quantity of various bacteria that are going to digest certain foods. One big thing that does happen with multiple sclerosis patients is dysbiosis. And that's going to be where there is a degradation or a lessening of diverse gut bacteria. And so it is important to maintain not only the prebiotics that are setting up the environment to maintain the good, healthy growth, but also the probiotics to ensure that we have a diverse quantity and quality of that good bacteria.
Excellent, thank you. And lately, as I age, I became more interested in plants. Something that I never had an interest in my life before. Kathy can attest to that. That I was really good at killing plants, but never. So, and lately I've been looking at different soils and different plants and nutrients. Yeah. So I heard once by nutritionists saying that the prebiotics are pretty much the nutrients in the soil and the soil itself, whereas the probiotics are the plants that you're going to plant in that soil. Is that a good analogy to explain the difference between the two?
I think it's a good, well, the prebiotics are going to be your soil. The prebiotics are going to be what allow your plant to grow. And then your probiotics are going to be the actual plant, the bacterial growth. And so, yeah, it's a great analogy, and everything needs to work in concert. You need to have the appropriate environment, and you need to have the appropriate bacteria. And if you don't, then you run the risk of having GI infections, and then it's kind of a starting all over trying to propagate those bacteria.
And we usually bring the prebiotics, meaning the soil and the fertilizer, with the foods that we eat, right? So our diet is pretty much what is creating that environment. Mm-hmm. So sometimes if patients they take probiotics, but their soil is not good quality, the plants are not going to survive, right? So you need both. You need a healthy diet, and also you need the healthy bacteria. I personally recommend to take probiotics, which are the bacteria itself, only in certain circumstances, as usually in cases in which patients are taking antibiotics for UTIs or for other reason in which we know that that can actually alter the flora. But in general, what I recommend is the prebiotics, right? So a healthy, well-balanced, nutritious diet. So Dr. Holland, I'm going to put you on the spot one more time. So can you tell us in 2 minutes, what is a healthy, well-balanced diet in MS?
2 minutes. So my mentor and one of my wonderful principal investigators, the two of them developed the MIND diet, and that's typically what I lean into, which is the Mediterranean and DASH intervention for neurodegenerative delay. The big components there are maintaining good, healthy foods and this quantity and quality of diverse nutrients and bioactives. So big things with that are going to be dark leafy greens. Those have profound concentrations of nutrients. We're talking about carotenoids, vitamin K, flavonoids. They're just packed with a lot of nutrients. Berries are another big category. Beyond that, other vegetables. Whole grain is very good. I know there is a lot of concern with gluten allergies and the potential for being pro-inflammatory, but making sure that somebody's taking complex carbohydrates is going to be good. Then we also have fish. And the big components there are the fish oils. So our omega-3 and then also the omega-6s. And those are going to be very beneficial for vascular health as well as just neural health in general. Beyond that, we have nuts and we also have olive oil. And then we also have this other category where we have foods that we want to try to trim down. So that's going to be your high-fat dairy, working to decrease butter, decreasing red meat intake to 4 or less meals per week. Also trying to decrease your fried fast food and baked goods. And what that is doing is we are increasing our intake of anti-inflammatory foods that contain those anti-inflammatory nutrients and bioactives, and we're decreasing the foods that contain pro-inflammatory components, in particular the fried foods and the high-fat red meats and dairy. So that's where I like to sit with my foods. And it's I know there's a lot of diets out there. I like to go with what's easiest for me. And you can find Mind diet sheets online. And I have one, on my fridge, and I just tick off as I intake what I need to per day or per week. And it helps me to visualize and maintain what I'm doing with my diet.
Excellent. Well, great answer. And there are questions already asking if you see patients, and I'm going to answer for you. You don't see patients currently, but we have a brain health clinic that is run by Adrian Castillo. She's our wonderful nurse practitioner at the MS Center. And Adrian works with Tom Holland very closely, and Tom is also our faculty for the MS Masterclass, which is his 3-week program. So you have a lot of opportunities to learn from Dr. Holland. And if you have specific questions about your particular diet, you can also consult with Adrian, and she has a direct access to consult with all of our team members, including Dr. Holland. Is that fair to say, Dr. Holland?
Oh, yeah, that's very fair. I've been delving a lot more into research components, so pulling back on clinical aspects.
Excellent. Well, I'm going to go back to Jackie for a minute, Dr. Bainbridge. And there is a lot of interest, and has been a lot of interest for the last decade or so, about the role of cannabinoids, CBD, THC in managing MS symptoms. And I know that that's an interest of yours in research and in clinical trials and others. So can you give us a summary of what you've learned, and what are the elements from your research that we are ready or prime time to be able to share with our patients in terms of recommendations?
Well, you probably should give me a timer on this because I could talk way too long on this. So I think the very first thing to know is we need more evidence. We need more evidence for specific disease states, which cannabinoid, and getting the same cannabinoid time after time after time after time. Because when patients, especially in Colorado, different in different states, but when patients are going to dispensary, even back to the same dispensary, oftentimes they're not getting the same product time after time. So then it's really hard to tell what's working, what isn't working. So the evidence is really important here. The next thing is to know the research out there and what's the difference between THC and CBD. And they both work in the brain. So they're both active in the brain. The difference is THC is euphoric and produces a high effect or a recreational effect, and CBD does not. So it's non-euphoric, but they both have properties and work in the brain. So that's the first thing to know. If you look at the clinical trials specific to multiple sclerosis, Sativex, which is approved in like 28, 29 other countries, is not approved on the US market. It did fail one aspect of the Ashworth scale for spasticity in patients with multiple sclerosis. So I'm hopeful that they're going to work that out and come back and go after those clinical trials in the US. That particular product was about a 1-to-1 THC and CBD oral mucosal spray. And that was helpful for patients with spasticity. It could be painful spasticity or not. And it was multiple sclerosis, but also other patients with spasticity, so spinal cord injuries, etc. So I'm very hopeful that that product does at least come back into clinical trials here in the United States. Much of our research has looked at back pain and cannabinoids. So we really were looking at a vaporized product. So using a volcanic vaporizer. Never thought that I would be counseling somebody on how to use a volcanic vaporizer. One of my patients brought that up, and then he said, and I never really thought that I would be paid to smoke weed, but here we are. So anyhow, we're waiting on the results from that clinical trial. Several clinical trials, we know CBD is effective for certain types of epilepsy. Also looking at behavioral aspects in the autism spectrum. Again, that was CBD, not THC. We know THC is in particularly bad with anxiety because it can produce that. Also depression. So THC and those two indications really are not where to go. And sleep, there's a habitual, if patients are consuming THC products, you find that they have to use more and more and more. So there's a habitual pattern. They're in a tolerance effect. So it might get you to sleep, but patients don't stay asleep. CBD, much better in that arena. And the other thing I need to really caution people about is there are several drug-drug interactions that we see with CBD and also with THC. So specifically, I mean, CBD you can get anywhere. So it's really important to talk to a pharmacist, talk to a practitioner that can look to see if those interactions are present, because they are substantial interactions with increasing the serum concentrations of other drugs. And also we see gut effects. So Dr. Holland, I'm sure you've heard of some of those issues and problems, especially with CBD high doses. So I think it's probably a toxicity effect or a trapping effect in the gut. We also see problems with high dose THC with the hyperemesis syndrome. So which is pretty unique to THC products. So patients are consuming it. That's how I actually got interested in the research in neurology, because so many of our patients were using cannabinoids, and no one really knew what to recommend, what dose to recommend, and and how to use it, how to instruct patients on and using it. Harms and good, but we definitely need more research in that
So
arena.
basically, Dr. Bainbridge, if I understood correctly, so we need more research, we need more evidence. Unfortunately, in the US, we do not have an FDA-approved product that actually we can recommend. And the risks these days are like, we don't know, and our patients don't know what product they're getting, even if they go to the same dispensary. So is there any area within symptom management in MS that cannabinoids is the only option we have? Or would you say, well, if you're using that for spasticity, let's just try other things first before we go to cannabinoids? So is there any true role that cannabinoids is currently it should be considered in MS, or we are not ready there yet?
We're not really there yet. There are other products that treat all those other symptom management. So that's a very good point. So it's not our first line product. That's not where we're going to first. There are several traditional products out there that can be used to treat those conditions, ones that we know much more about.
Excellent. And Kathy, I see a couple of questions. I'm going to take one while you look at the other questions. There is one about the MTHFR gene mutation. That's the methyl tetrahydrofolate reductase mutation. It's another mouthful. It's a rare variant, but up to 60% of the people can have one variant of this mutation. In general, what it does is just creates an imbalance between certain amino acid levels and proteins in the blood, usually homocysteine, and that could have some kind of pro-inflammatory effects on the brain. So there are certain things that we can actually check for that mutation that we often do, which is, we do a homocysteine level, vitamin B12, folate, and I often use methylmalonic acid as well, because it's kind of like a precursor of folate deficiency. And so in general, we recommend to supplement with vitamins on the B complex. Dr. Bainbridge, anything else that you do in these cases?
No, I think just thinking about it, the B vitamins is mainly where we stick.
And you mentioned briefly about sometimes B vitamins can cause toxicity. And I recall a patient of mine that was having this very profound neuropathic pain, like the nerves in the feet were very painful, and nothing we did helped. And all of a sudden, I went through the that he was taking, and in the bottle it said 2,000 times the recommended daily dose of vitamin B6. And there is a well-known toxicity that vitamin B6 does in the nerves, and sometimes that presents as a painful neuropathy. So a question for Dr. Bainbridge. It's more better when it comes to vitamins? Do we need to go to that 2,000 times the recommended dose, or we should probably stay away from it?
We should definitely stay away from it.
So read the labels, right, for our patients.
Right.
So for our patients, please read the labels, because we don't need 2,000 times the upper limit of normal, right? In that area, is there any brand of vitamins or any type of recommendations? If someone is in the grocery store trying to look for vitamins, any hints or tips that actually you might want to share with patients?
Sure. There are a few. And if you ever have a question and you're searching the aisles in the pharmacy, definitely tap your pharmacist and ask about it. And anytime you start taking multiple capsules or pills of anything is a red flag, right? So maybe I need to rethink this. There are a few brands that we recommend. And so, our confidence level as pharmacists are with the FDA and the USP, so the United States Pharmacopoeia. So basically, that has to do with good manufacturing processes that you're doing the same thing over and over and over again. So you're establishing a capsule or some dosage formulation that you can tell what is really in one pill, one capsule, whatever it is. So we always go back to the USP, and there are a few brands that we know are very reputable with this. And one is Nature's Made. So that is on many pharmacy shelves. There's another product that's called Thorne, Thorne. And then there are several other ones that are pharmaceutical grade, so not USP recommended, but pharmaceutical grade that you can only get through your pharmacist or pharmacy or your physician. So sometimes you'll find that those products live in a physician's office. And again, those are high quality products. And so again, that is really, really important when you're looking at these products. And as I mentioned, the B vitamins that are methylated, getting those products, you have better absorption and much better for you. Making sure that your fish oils aren't expired. So you don't want to take rancid oil because you're going to generate free radicals, the things that you're trying to get rid of, and you're having then an inflammatory effect and not an anti-inflammatory effect. So Nature's Made is the easiest one to find, but there are several others, like I mentioned, Thorne or several.
Every time I spend time with Dr. Bainbridge, I learn something, and even if it is 5 minutes having a cup of coffee. So thank you. I didn't know about the expired fish oil, and just for clarification, there is no conflict of interest whatsoever of any of us with Nature's Made. This is just a pure scientific recommendation. Kathy, any questions from the audience?
Yeah, and this is one that I have actually not heard of, so I am quite curious. This might be a little bit more for Dr. Bainbridge as well, but any thoughts around sea moss? If you could talk about that one.
I haven't, I don't know a lot about sea moss, but I have heard about it actually. So I think it's like up and coming, but I don't know a lot about sea moss.
Excellent.
I can get back
Okay.
to you on that.
Well, I don't feel like I'm totally in the woods then. And what is your recommendation for antioxidant supplements? There are evidently some mixed opinions on things like NAC, if you can maybe speak to that.
Yeah, I think just going over NAC, I have a lot of patients that we have recommended that. Antioxidants are great. I would go back and say, Dr. Holland, what do you think? And my guess is your antioxidants should really come from your food source, if possible. Now we know sometimes that's not possible to do. But you have to, when you think about the antioxidants, again, that free radical scavenging kind of component, you find that vitamin C is a potent product, But again, you don't want to recommend taking that on a daily basis, especially in patients with multiple sclerosis or anyone. So if you feel a cold coming on or whatnot, that's when to think about, some of the antioxidants. There are a few other things that I think of when I think of, when you feel like you're coming down with the flu or colds, and we can talk about that in a little while. But you can overdo any of that, and there are interactions with the bioflavonoids. So some of those antioxidants and products. So I would just say food source is the better source. I don't know if anyone else has anything to add.
I agree. No, there was a study on NAC or N-acetylcysteine in MS, or a couple of studies, I believe, and one look at an oral supplementation of 600 milligrams daily, and they had some effect on the usual markers or biomarkers of being an antioxidant, but truly that didn't translate to any clinical benefit. And there is also some side effects, like a sulfur or metallic taste and asthma. So they are contraindications. So I will say just check with your physician before doing that. And talking about again diet and the benefits of perhaps getting your nutrients and antioxidants through a well-balanced, healthy diet, which, to be honest, I agree, because not only that, it's easier and better, but actually creates this psychological cycle. When we eat healthy, we tend to be healthier, and we exercise more, and your health becomes in a different level as opposed to just popping a pill. So, Dr. Holland, we talked about the microbiome before, and how MS patients may have an altered microbiome. We call that dysbiosis. But let's talk about the good news. Can we change the microbiome? Is there anything we can do to alter our microbiome, regardless where we are? And if the answer is yes, how can we do that?
Yeah, so first and foremost, I do want to mention the aspect of these nutrients and getting it from your diet, because if you look at the back of a multivitamin and you've got your sodium, potassium chloride, maybe it has a B complex, maybe it has some other minerals in there. That's what's in your multivitamin. Now, if you were to eat a salad that has, say, some cherry tomatoes, some onion, you use an olive oil vinaigrette, you are going to be intaking, roughly about 80 plus different vitamins, minerals, and bioactives by consuming that salad versus the multivitamin. I really enjoy and appreciate supplements, and I think they really help bridge gaps, and especially if people have difficulties in intaking some of these foods. But by and large, the foods that we consume are going to have a larger, diverse quantity and quality of these nutrients and bioactives. Now, to your point on the microbiome, this is a wonderful question. I absolutely adore this question, because it iterates the need for patience when we are making modifications in anything that we do. Whether or not it's changing physical activity and we have some muscle pain, or we're learning a new skill, it can be frustrating at the beginning. Diet is no different. So our microbiome can start changing within about 24 hours of our diet changing. And the reason being is that our body wants to be able to digest the foodstuffs that we intake. However, it's going to take about a month for the gut microbiome to fully modify to be able to digest those foods. So an example of this is if you were to be on a diet that has, a typical Western diet where it's a high trans fat, and you're intaking, say, a 70-30 burger on a regular basis, and you're digesting those. Well, you decide that you're going to start intaking a salad because you want to start getting those rich nutrients. Well, your gut microbiome is primed for digesting the foods that you have been intaking. Now, all of a sudden, you throw a salad on it, and your body says, whoa, I don't think I can digest this. Well, it's going to try to do its best. However, some of that leafy green is going to get through to the large intestine. And when it's in the large intestine, there's different bacteria there. However, the large intestine doesn't have the opportunity to absorb a lot of these nutrients. It's going to be a lot of absorption of fluid, and some minerals, but a lot of it's going to also be storage. And so you're going to have gas, bloating, diarrhea, abdominal discomfort. So on the flip side, let's say you're eating really healthy now for say 6 months, and you decide that you're craving this burger, and you go and you do a 70-30 burger. Well, your gut microbiome has been primed to digest, say, olive oil and fish and the fatty acids in fish and the berries and the various aspects of leafy greens. Well, now all of a sudden, that fat is going to move immediately through your GI tract, and you're going to have fatty floating stools because your body isn't going to digest and absorb it. And again, you'll have some abdominal discomfort and pain. One story that I like to tell is I had an individual that was in a trial and was taking olive oil. And I got a call and set up a meeting with this individual, and they said, I can't go outside after 12 o'clock. And I said, walk me through your day. What's going on? And they said, well, I get up, I have breakfast. At about 10, 11 o'clock, I take my double shot of olive oil, and then I go about my day. And I said, oh my gosh, have you intaken olive oil before? And the individual said, no, not really. And I said, so you're taking a double shot of olive oil at about 10 or 11 o'clock? And they said, yeah. And I said, well, it's going to take some time for your gut microbiome to be able to digest the olive oil, and let alone that amount of olive oil. And I said, essentially what you're doing is you're lubricating your bowel. So not only had this individual's microbiome not modified to be able to digest the olive oil, they were also overloading their system. So in that sense, we came to the conclusion and resolution of, let's saute some vegetables with half a tablespoon, maybe do a half a tablespoon on some high grain toast, and maybe we do a little bit more in the afternoon on a salad. So we spread it out throughout the day, and we make sure that the body can intake and handle the amount that's coming in, but we also allow the body the time to modify that gut microbiome to digest those particular foods coming in.
Excellent. I always love listening to you, Dr. Holland, because you make something so complex being so relatable and understandable. I have to say, last night I had a cheese night, and I felt guilty after listening to you telling me that it's all trans fats and we only should have like a small cube of cheese. Well, yeah, I thank you. You changed my behaviors, but once in a while, I still enjoy my cheese nights. Anything else, Kathy, from the Q&A? Any questions?
Yeah, and we do just have a few more minutes. Maybe I'll go to some of the supplements that are gummies. And again, I know you, Dr. Bainbridge, you had talked about Nature's Valley being a good, so Ollie obviously is a pretty well-known brand out there. And in particular, I think this individual was asking about any effects on the brain for stress gummies.
I'd have to look and see what's in stress gummies. So, and I do like that brand. That brand also is really, pretty good. They have a good sleep aid, I know, which is a melatonin formulation. And the stress, it might be, I don't know what's in it specifically. So it would be hard to say. Again, if you're going to take something like that, I would just say, don't overdo it. Look and see what's on the label. And if the label tells you to take 4 of something, I would still probably start out with 1 and then move up slowly. Because again, you just don't know how your body's going to respond.
Sure.
So,
all right. Well, I have a question for each. Oh, sorry, Dr. Holland.
Oh, and I was just going to say the aspect, I think, across the board, regardless of the modification that you're doing, whether or not it's a stress aid or diet, physical activity, cognitive activities, anything across the board is low and slow. Start with low amounts, and then you get to a steady state. And the same thing if you're coming off of something. We want to make sure that your body has the opportunity to change with the new normal for your body. And so you don't want to flood the system with something and your body has this adverse reaction because it doesn't know how to handle it. So low and slow is always the recommendation for onboarding or offboarding some aspect of activity.
I think one other question, this is probably just out of curiosity with a lot of folks, is, when you go to the pharmacy and they change, when you're filling a prescription and they all of a sudden change the name from when you get a generic product from what the original name is. Is there any reason for that? Dr. Bainbridge, maybe you could just comment on that one.
Sure. And you should definitely always ask the pharmacist about that, because what you don't want to have happen is that be the wrong product or the wrong prescription kind of thing. So I would always ask about that. Generally, what we see is that the generic, there's a big group where the pharmacy will get their medications from. So the manufacturers, so the group where the bigger supplement, or not supplement, but the wholesaler, oftentimes will change the generic medication that they're getting, and it all is based on cost or price. So they're always looking for the best price for those medications. So, because every drug has a generic name and a brand name, now you'll see that there are several brand names that come out, and it depends on if you're getting the generic or the brand. If you're getting a dispense as written, only brand, then it should only be brand. So Synthroid should always be Synthroid. It should never be levothyroxine. But levothyroxine is the generic name, and so that will change all the time with the pharmacy. So one time you can go and get one different manufacturer. The next time it's a different manufacturer, and it all has to do with what the wholesaler has to distribute to those pharmacy boxes. So the pharmacy. But always, always, always ask about that if you have questions. And certainly if your medication looks different than what it has. Now, your generics are going to look different, but I would always question that.
Oh, very good. Thank you for that. Well, we only have a few minutes left, so I think hopefully it's okay for us to wrap up, but I'm going to end with one question that was still in the chat box. And Dr. Miravale, this one might be going directly to you. And the question is there a pharmacist working with the Rush MS Center?
Unfortunately, no. And we have pharmacists at Rush, of course, and they are inpatient pharmacies mostly. We have some outpatient pharmacists, but they are not integrated into our team the way I would like to see. So this is something that we are trying to work on. Of course, it takes a lot of effort to build that team and to actually find the resources to support that person. But they're critical, as Dr. Bainbridge mentioned before, in terms of enhancing the care that we provide. So probably we can end, asking both speakers today, starting with Dr. Bainbridge, highlights from today, things that, of all the things we discussed, which are the kind of highlights that you would like the audience to leave this hour with clarity on the things that we know we can recommend, anywhere from vitamin D to cannabinoids to supplements.
Yeah, thank you. And this has been such an honor to work with you all. Definitely, I would say less is more, and definitely vitamin D. I'm an omega-3 girl. So I think those are really, really important recommendations.
Excellent. And the same to you, Dr. Holland. Any highlights from, diet, microbiome, and everything else we can do to enhance our health?
Yeah, I think the main thing is get a colorful plate. When you look at your plate, it shouldn't be beige across the board. You should have a very colorful sprawl of greens and berries and nuts, olive oil, fish. Getting, these diverse foods allow for diverse intake of those nutrients. And, at the end of the day, what you're intaking is going to dictate your gut microbiome. And so trying to be cognizant of as we discussed earlier, the pre and probiotics, set up the environment and make sure that you're getting the good bacteria. And that's going to allow for more efficient digestion, which is going to allow for more efficient absorption. And that's going to allow for those nutrients to get to the organ systems that they need to function appropriately.
Excellent. Well, thank you both. It's been an honor having you both here. I learned a lot today. And with that, I'm going to pass the baton back to Kathy to finish the program today.
Yes, and I would like to piggyback after Dr. Miravalle. Fantastic session. So often, we have these 1 hours, and this is one where I kind of wish we had more than just an hour, because I think, this is such a fascinating topic, and it's always so great to have Dr. Holland with us, and I always learn a ton from him. But Dr. Bainbridge, thank you so much for joining us this evening as well. This has been fantastic, and I know our audience really appreciated us covering this particular topic. So thank you to the both of you for being with us this evening. A great start to kick off our summer series. As I had mentioned, our next one is going to be July 14th. I had to double check to make sure I'm putting out the right date. And we will be discussing acupuncture, mindfulness, and pain management with Dr. Angela Lorbeck. So look forward to having everybody back with us for our July session. And again, thanks so much to both of our speakers this evening. This was really great. So thank you so much. On that note, hope everybody has a great evening, and we'll see you soon. Thanks so much.
Thanks for having us. Have a great night.
Yeah,
Good night.
thanks, guys. This was fun.
Yeah, see you. Bye-bye.
So, Dr. Holland, I have a question for you. I'm going to have to email him.